Well, good morning, everyone. Hopefully this live stream thing will work today. And we're just waiting a couple minutes for a few more people to hop on. And you can get ready by opening the case study questions that have been uploaded to Moodle. And also have open your transfusion reaction procedures if you can. I will be popping them up on the screen here. And we'll start having a look at that in just a moment. All right, well, my clock says 11 o'clock, so I will give this a try. If you're accessing the stream, please give me a hello on the chat and tell me that you can see this stream. You should be able to see the case study 1 questions up on the screen now. Awesome, so far so good. So I know there is a little bit of lag between the stream and what you hear, about 20-30 seconds, and that's okay. So here we go. I want to look through these case study questions. There are 3 cases that I'm going to go over, and I would like you to fill out these questions and submit them in the assignment above this link on Moodle. And I'm actually going to give you part of the answers as I go through them, and that's okay. So case study 1, we're going to see the explanation up at the top here. A 67-year-old man came into the facility, so a hospital, for a bowel obstruction surgery. 3 units of plasma were prescribed pre-operatively, and he developed urticaria during the transfusion of the 3rd unit of plasma. A transfusion reaction report was sent to the transfusion medicine services, and the TMS tech, that would be you, review the case 1 transfusion reaction report form and then follow the transfusion reaction investigation process and procedures in answering the following questions. So let's have a look at the first case here. And we're not going to go to number 4, we're going to do number 1. So here it is. These are uploaded on Moodle as well. So our 67-year-old man, his name is Daffy Duck. Nice. So he came in for a bowel obstruction surgery. They decided he needed some clotting factors and gave him plasma. And so the questions say, briefly list the steps required by a technologist after the arrival of the transfusion reaction report form. So this is the kind of form you received. Let's just work through it from the top here. So he's in a surgical ward. Yes, that's good. Number 1 here, patient and blood component verification. This is a clerical check that the ward is doing just to check if anything was missed. So is the information identical on all of the following? The patient ID band, the issue document and the tag, the blood component, and the product label. And they've answered us, yes, the information is identical. Excellent, that's good. So if the answer was no here, they need to contact us in the transfusion medicine services lab immediately because someone else might be at risk. What if they got the wrong product and there's a second patient who may be receiving the product for this patient? If they do notify the lab, there's a place here for them to document that they did so. So let's just go through this form to figure out what we're going to do. So number 2, clinical history. This might be of use to the pathologist. Okay, history of transfusion. Yes, within 3 months. So he did have a transfusion within 3 months. Number 3 is the current transfusion. So we're saying that today is the 7th of August, 2009. We're going back in time. And this is the information about the transfusion that caused the reaction. So the transfusion was started at 1700, the reaction occurred at 1820, and they stopped the transfusion. And then they did restart that transfusion at 1845, and it was completed by 2010. This is the time, 2010, not the year, 2010. Okay, so remember, which is the only kind of reaction with which a transfusion can be restarted, and it is this one. So down here in the symptoms, all we've got here is an urticaria as a change, pulse, very much similar, respiratory rate similar. Okay, so his only symptom was urticaria. And in a second, we're going to go to the procedures and see what that means. So plasma, they list all 3 units that he got, how much volume he received. They treated him down here in number 6 with antihistamines. That makes sense. And they notified the physician. And this was reported by, this would be probably the nurse. There he goes, designation is an RN. And they didn't actually notify the lab because they don't need to. Okay, so let's go to the procedures and see if this makes sense. So procedure 1. So I'm hoping now you're a little bit familiar with these procedures. Some of you are done your flowchart assignments, and others, hopefully you are working on them and have looked through these now. So procedure 1, responding to the report. Okay, so in this case, we received a transfusion reaction report form, right? So go to step 2. Let's go down to step 2. Check that the form is complete. Ask for any missing information. Check the signs and symptoms of the form for the following. So these would be some of the things that would be listed in question number 1. Briefly list the steps required that you would do. So you're going to check that the form's complete. Check the signs and symptoms. So if the signs and symptoms are urticaria, yes, then that's it. No samples are required. Send the report to the technical supervisor for correlation. And that's really where it ends. So over on the right-hand side here, it goes actually all the way to procedure 6, which is what the supervisor would do to make sure all the information is complete and see if any other follow-up is required. So that's really the end of that transfusion reaction investigation. So if we go back to the questions here, briefly list the steps after the arrival of the form, so you can list those. Does this reaction qualify as a 24/7 pathologist trigger? Well, what we read just now in procedure 1, no, this is not a pathologist trigger. You have a transfusion reaction with urticaria only. They restarted the transfusion and they completed it and nothing further. So that's a no there. Should the number 3, should the clinical staff phone the lab? No. Following that procedure number 1 that we just looked at. So you can answer the rest of these questions. And number 7 down here is hopefully gathering or kind of accessing some of the information in Module O. With this symptom, what type of adverse reaction is this? Okay. Number 6, hopefully you've I'm just going backwards here. Number 6, hopefully you've made sense of this one. If additional units are requested, so before the investigation is complete, should you call the pathologist for approval? So you can follow the steps and see what you think for this case. So that's case number 1. More of a simple, straightforward one. Now let's go to case number 2. And this is a check-in just as we finish case number 1. Is this thing on? Let me know if if you could see all that in the case number 1. So far so good. That would be great. We're going to go over to number 2 shortly. Whoop. I should also ask if you have questions along the way, just pop them in the chat. Oh, I keep going back and forth. Awesome, thank you. So let's go on to case number 2. So see if you can pop those questions up there. So case number 2 says, here's our description. A 69-year-old man with cancer of the colon was prescribed 2 units of red cells to treat his anemia. He developed fever and chills after receiving the first unit. The physician was notified, the transfusion reaction report form, the RBC bag and tubing, a post-transfusion sample, and a post-transfusion first voided urine sample were sent to the lab. So this is what you have now received. So we'll have a look at the case number 2. And the question is, briefly list the steps again after the arrival of the form, the red cell bag and tubing, the post-transfusion sample, and the first voided urine. So let's have a look at the TRR form for case 2. Oh, other one. Case 2, here we go. So this time our 69-year-old man is Mickey Mouse. Hello, Mickey Mouse. Poor Mickey Mouse has cancer of the colon. Not a fun time. So we know we should check if this form is complete. So we'll start up here, number 1 again. Is the information identical? This is the ward's clerical check. Yes, that is good. Okay, and they didn't need to call us, so that's good. Number 2, history, no transfusion. All right, good to know. Number 3, now it is the 4th of January. Transfusion was started at 14:36, and the reaction occurred at 17:30. So this was a slower infusion, right? Remember that the time limit for an infusion is 4 hours, so 2:30 to 5:30 here. And they stopped the transfusion at that time and did not restart it. So that should make sense with the symptoms that he's got here. So pre-transfusion temperature 36.7, post-transfusion 38.8. So that is a significant rise. He's got an increase in blood pressure. Pulse was slightly increased. Respiratory rate was about the same. So what's significant here? He's got chills and a significant rise in temperature, which equates a fever, right? So both qualifiers are there. It increased at least more than 1 degree above the baseline and is also over 38 degrees. So that's a fever. So we've got fever and chills. Those are significant. Here's the component. He was getting red cells. There's the unit number. And the volume transfused was 312 mils, which makes sense because this transfusion was running for about 3 hours, so he would have been just about finished receiving all of that. Number 6, what did they treat him with? Antipyretics, so probably some Tylenol or ibuprofen there. They notified the doctor and they reported it, and here's the RN's signature. They did not call the lab, and that's all right. So let's go have a look at the questions. Actually, at the procedure, how about we do that? So we've got fever and chills here as our symptoms. Let's remember that and go over to our procedures. So back to procedure 1. Responding to the report, we got a report form, so we're going to go here to number 2. Okay, down to number 2. Check that the form is complete. So we did that. It looks good. No missing information. Check the signs and the symptoms. So if the signs and symptoms are basically anything other than urticaria, pruritus, or IVIG related, this is all in the same process. So we are going to need samples, which they did send, which means either they called the lab and had a collector, someone come up and collect them, or the ward collected them. One way or the other, we got some post-transfusion samples and they are received. And we're going to go right to step number 6. So let's scroll down to number 6. And what are we doing here? Basically, this is where we're starting our investigation. We're making a worksheet. So record the following on the investigation document. So name, identifiers, location, symptoms, create a file, record all communication details. At this point, we haven't called a pathologist. That hasn't been triggered. Number 8, quarantine all tagged blood components for this recipient. So he was due, I think 2 units were ordered, and this was the first unit. So the other second unit needs to remain in quarantine in our fridge, and that cannot be released at this point. The second line here, quarantine component product for a second recipient if applicable. This is talking about if there is a misidentification and they've found it at this point, who else could be involved? Are there other transfusions going on at the same time that may have been mixed up as well? So it's really important to look for. Number 9, update the recipient's transfusion history. And we're going to place an alert on there that says, please don't issue any more products for this patient until we figure this out and it's all approved by the pathologist. Number 10, evaluate the forms and samples and components and products involved in the reaction. This just means carry on to procedure number 2. So let's do that. Procedure number 2. Okay, so evaluating all the pieces of the puzzle here. Call the pathologist immediately for approval of release of quarantined or additional components and products if the investigation is not complete. I believe that's one of the answers to your questions. If the ward phones down and said, well, hey, this guy's still anemic, we want to transfuse him some more. Well, at the moment, we would say, well, I got to get approval. So in that point, I would call a pathologist and explain the situation and see what they think. Required samples here. This is what we should have received. 2 times Atol EDTA, collected by the ward, or it can be ordered by the ward and collected by the lab. First voided urine, which it did say we have received. In some cases, this would be mandatory, but in a case where the new onset of red-brown urine is not reported, it is technically not mandatory. It doesn't hurt to do it and to look at it, but it's technically not mandatory. Blood cultures would only be done if bacterial contamination is suspected. So let's see if we catch upon one of those triggers. Okay, require the component and product back, yes. Administration lines attached, no needles please. May include empty bags or containers from the same transfusion. So hopefully we've received all those pieces. Now what are we going to do? So check the clinical signs and symptoms and the blood components section of the TRR form to determine if clinical staff is expected to send forms, components, and samples. So we've determined that yes, we do need these things. These instructions are also located on the back of the transfusion reaction report form. So the ward always has access to those instructions. So let's see here. Does this make sense? We'll go down the column here. Not IVIG related, not urticaria or pruritus. Is there suspected bacterial contamination? Well, we'll get there in a second. All other unexpected signs or symptoms. Yes, we need a form. Yes, we need the component back. And yes, we need samples. And a first voided urine is recommended. Okay, so table 2. Does this particular reaction qualify as a suspected bacterial contamination? Well, let's see. We've got fever defined as an oral temperature of greater than 38 and a greater than 1 degree rise above the baseline. Yes, we have that. Plus any one of the following. Was there rigors, nausea, dyspnea, hypotension, tachycardia, or shock? No, in this case, no. We only had fever and chills, if you remember that. Okay? Or, here's a big or. Fever defined as oral temperature greater than 39 and a 1 degree rise above the baseline, even in the absence of other signs and symptoms. So was this patient's temperature above 39? I don't believe so. But let's hop back and look. What's this one? Okay, case 2. His temperature was 38.8, so not quite there. So technically does not fit in that category. So let's go back to here. Okay, so doesn't fit here, doesn't fit here. Or, here's another or, fever not responding to antipyretics. Well, they didn't indicate this, so it doesn't fit in there. Or a high suspicion of sepsis even in the absence of fever. Well, the ward hasn't indicated this either. Okay, so table 1 indicated we received everything we needed to EDTA, urine, the product, and the form. But we did not need to do anything further because of suspected bacterial contamination. If we did, the other additional thing here is recipient blood cultures are recommended if it fits into this table 2 category. Okay, so this case did not, so let's keep going. Number 2, determine if the transfusion reaction report form is a follow-up for a preceding call from clinical staff regarding a following pathologist trigger. Did we receive a phone call? No, we didn't. And there are no pathologist triggers. So we'll just continue on. So number 3, retrieve the following. We've got documents. So this means our worksheet document, everything attached to the unit, TMS copy of transfusion record. This would be if in our lab they had been transfused before. Usually in most labs this is now on the lab information system as an electronic record, but some labs might still have a paper record that you need to check. So that's important. Pre-transfusion cross-match records, so the work that was done before, and the report form. So we're going to gather everything together. We have the returned component with the attached set, and we have samples. So we're going to pull out the pre-transfusion samples from the fridge as well. So we have pre and now post. We can pull out that unit segment from the fridge in case we need that. In this case, we are not doing blood cultures, so that was not done. And then the post-transfusion urine. Basically, any other symptoms other than red-brown urine, the urine is not mandatory, but it may be done as a routine thing. Contact the nursing unit for anything missing. In this case, we have everything we need. So number 5, enter the following clinical information in the form, or from the form to the lab transfusion reaction investigation form. So this is going to be our worksheet in the lab. Let's see, when did it happen? What component was involved? How much did they get? What were the signs and symptoms? This will be our record that we keep in the lab. And check section 5 of the form to see if plasma protein products were reported. So in this case, the reaction was to red cells here, which is a component. It was not IVIG, it was not RHIG, and it was not a plasma protein product. So we're going to keep going to step 7. Perform the clerical check by checking that all the recipient and component product information is correct and identical on all samples, components, products, and documents. This is including your lab information system. So you're basically checking everything for everything, right? So you're going to be very thorough here and checking every little detail on every piece of the record. Okay. Number 8, review the history and the pre-transfusion for antibody status, special components required, other comments related to this recipient's transfusion care. So were there recommendations for certain treatments? Okay, making sure everything was done properly. Returned the component and product. Is it actually compatible with the recipient? Is it antigen negative if there were alloantibodies? If there were special requirements, does this product fulfill them? Again, you're checking everything. Okay, so you checked everything. Number 9 says, so evaluate what you found. If everything is correct and identical, proceed to step 10. So let's do that. Let's just say everything's good. Perform a visual inspection on the returned product, record the results, and review as follows. So if it was a blood component, which it is, and it was normal, then you would go to step 11. And this is saying send that returned unit, so the actual unit, not the segment, for cultures if. So this is basically the follow-up to if the signs and symptoms qualified as a suspect bacterial contamination, then not only does the patient get blood cultures, but the returned unit also gets cultured. So there's basically the same requirements that we looked through before. If those requirements are not met, then they would not culture the unit. Okay, record all your results and proceed to primary examination, which is number 3. So let's have a look at the questions again. Back to number 2. So we've looked at his signs and symptoms reported on the form. Number 1, briefly list the steps. So that's what we just partly went through. We're not done yet. Does this reaction qualify as a pathologist trigger? No, we didn't find we had to call a pathologist, so that's a no. Number 3, should the returned blood product be sent for blood cultures? That's where we just left off. So that answer is a no. Number 4, would you perform a primary examination? Yes. It's interesting that at the end of procedure 2, it just automatically, everybody continues on to procedure 3. So yes, you would do a primary exam. 5A, if additional units are requested prior to the completion of this investigation, should you contact the pathologist for approval? And we answered that question right at the beginning of procedure 2 with that note that says yes. If the ward calls and says, please give us some more product for this patient, you need to get pathologist approval to release that product. Okay, 5B, if the primary examination in this case is normal or unchanged, do you need path approval to release the quarantined units? Well, let's see what we find in the primary exam. Okay, let's go back to that. Let's make you go over there. I'm just pausing for a minute. And let's see how it's going. All right. So just a little pause to check in there, and that's all right. So now I'm hopping back to procedure 3. So we're on case 2. We went through procedure 2 where we discovered that this reaction does not qualify as a pathologist trigger. It does not qualify as a trigger for blood cultures on the patient, and it does not trigger the culture of the unit as well. Awesome, that's good to hear. Things are ticking along okay. So let's finish off this case 2. The end of procedure 2 says proceed to the primary exam, so let's go through that. Procedure 3, primary examination for an acute transfusion reaction investigation procedure. And again, that same note is here. Call the pathologist immediately for approval of release of quarantined or additional product if the investigation is not complete. So good thing that wouldn't be up to you to decide. If you get a call from the ward that says, please issue, you can just let them know I have to get approval, and then you'd call them and see what they want to do. So what's included in this primary examination? Number 1, a plasma check. So at this point you've received those post-transfusion samples. You're going to spin it down and check the color of the plasma, literally just looking at it. You can pull out your pre-transfusion. Well, you should have pulled it out by now. If it looks the same and it's unchanged, that's good. We're going to go to number 2. If it's icteric or green or brown plasma, it's not normal, but we're going to go to step 2. If it looks like hemolysis, slight to dark, this is not normal. check the pre-transfusion sample for hemolysis as well, and reassess. So this is a big, long way of basically saying, is the post-transfusion sample hemolyzed from collection? Is it hemolyzed because of a condition that the patient had previously? Right? Check the patient's diagnosis and transfusion history. And we're just looking to see if the sample is hemolyzed and it can be ruled out as a collection, due to collection or due to a condition. So that's step one. And step two is the DAT. So perform a DAT on the post-transfusion sample, record the results, assess the results. So let's go down here. If the DAT is negative, the pre-transfusion DAT's not required. This is normal. Keep going. If the DAT is positive, the pre-transfusion DAT is unknown. Perform a DAT on the pre-transfusion. This again is to check, did the patient have a positive DAT before? Are there other conditions that are causing a positive DAT? This is part of ruling out, or maybe ruling in, a serological transfusion reaction as well, right? So let's see, if your DAT is positive, the pre-transfusion DAT is negative, review the history to see if there were any passively acquired antibodies from a non-red cell product. Okay, so what else is in this patient's history? And let's go down to the next one. If it's positive and at least 2 grades stronger than previously, this is not normal. Okay, positive and less than 2 grades stronger than the pre, this is considered no change. So we're saying, let's say the patient had an autoimmune condition or some kind of treatment that gave them a positive DAT before. It was 1+, and now it's a 2+. We're going to consider that no change. Okay, but if it was a 1+ before and now it's a 3+ or 4+, that is a significant change. So we did a plasma check and a DAT. Let's see what's in number 3. Urinalysis. Okay, so if we didn't get a report of red-brown urine, we don't really have to worry about it. We can check the urine if it does come, and we did receive it, but it would be routine in this case. And so we're going to skip this urinalysis here because that red-brown urine was not reported. So number 4, determine our next steps. So use the signs and symptoms reported on the form and the results of your plasma check, your DAT, and your analysis to put the results together. Let's see, if the plasma check, the DAT, and the urinalysis are all normal or negative or no change, no path triggers, this means the urine isn't mandatory. You can release the quarantined units, and the units can be, additional units can be cross-matched and issued to the recipient without pathologist consultation. Okay, update the recipient transfusion history, correlate the results, as in number 6, procedure number 6 there, which might be done by a supervisor. So that's where this procedure or this case actually went. And I think your questions ask you if. So this is the case we're asking about. Plasma check normal, DAT normal or negative, no path triggers. This is what we're going to do. If, on the other hand, something was positive, then we would contact that pathologist immediately here. Follow the instructions from the pathologist and continue on to perform the secondary serologic examinations. So we're talking here, there is hemolysis that you think is from the patient with no other explanation, or there is a positive DAT with no other explanation, right? Then you'd continue on to the secondary examination. In this case, we're going to end it here and say the plasma check was normal, the DAT was negative. So we would end it there in the above 4A. All right, so that's case 2. I'm just going to check in one more time, and we're going to flip over to case 3. All right, case 3. Case 3, we have Minnie Mouse. And on the top of her questions, or the questions for case 3, it says this. A 78-year-old woman, or mouse in this case, was admitted to the hospital with lumbar spinal stenosis. She was prescribed Ramipril, an ACE inhibitor, to treat hypertension, and 2 units of red cells to treat anemia. Excuse me. The patient received the first unit of red cells with no reaction, and after receiving 150 mL of the second unit of red cells, the patient suddenly developed hypotension and dizziness. The transfusion was stopped, and the transfusion medicine services and the physician were phoned. The transfusion reaction report form, the RBC bag and tubing, the post-transfusion samples, and post-transfusion urine were sent. Okay, so that's our case. Let's see what our transfusion reaction report form says. Now our questions are going to be similar. Briefly list the steps required, and they might be slightly different in this case. Because in this case, we received a phone call. So we'll have a look at the procedure in a second. Let's look through this form. So we've got Minnie Mouse. She has anemia. Number 1, is the information identical on the band, the issuing tag, the component? Yes. Excellent. That's good. Excuse me. Then number 2, clinical history. They gave her some medication for hypertension. History of transfusion, yes, but greater than 3 months ago. Okay, so not considered a recent transfusion. Today is the 6th of March, 2010. Transfusion was started at 11:37. Reaction occurred at 12:50. And they stopped it. And what are the symptoms we have here? So temperature 36.9 to 37.0. Okay, so no temperature rise, no fever. Blood pressure dropped dramatically. Pulse has dropped. Respiratory rate about the same. And then our symptoms here, dizziness and hypotension. So systolic blood pressure, that's what SBP means here. Systolic blood pressure drop of greater than 30 millimeters mercury. So that's this 105 to 68. That's the number they're looking at there. She got RBCs. There's the unit number. Volume transfused 150 mils. Measures and notification. So they administered some Ringer's lactate, notified the physician, and there's the signing nurse. And they also called the TM lab. This is who they notified in the lab and what time they called. So that looks pretty complete. And we've got symptoms here of hypotension and dizziness and no fever. So that's our case 3. So let's look at our procedures. Let's go back up to the top of this one. So in this case, we're back at transfusion procedure 1. In this case, we received a phone call So let's go down the triggers here. We received a phone call, and did we have a report of any of these things? A, was there a recipient identification error? No. Was there sudden onset of hypoxemia? Not that they told us. And C, sudden onset of hypotension? Yes. So hypotension is the one. And so proceed to step number 3. So let's go on down there. This is a pathologist trigger. So we got a phone call and asked the caller to complete and send the transfusion reaction report form. And now we have received this form, and that's good, and it looks complete. They've also sent us the samples, and that's excellent. Record information for the pathologist. So you could do this while you're on the phone, right? Say, oh, you're reporting a transfusion reaction. Here's what I need. The recipient name, identification, where are you, which ward is this on, what kind of symptoms, and who is your contact person for this case on that ward. Complete some other actions if they're also reporting red-brown urine. In this case, they're not, so that's fine. D here, contact your pathologist immediately. Doesn't matter what time of the day, there will be a pathologist on call, so it could be during the day, evening, nighttime. This means now. So you would do that. Follow the pathologist's instructions. So this would be normally quarantine other products for this patient. Do you think anything else is mixed up for someone else? And what else they think might be unique to this situation. And we've received everything we need at this point, so that's good. And go down to step number 6. Excuse me. Number 6. And this is where we're starting our investigation again. So make our worksheet, create a file, quarantine, update the patient's history, and continue on. All right. So procedure 2 we've looked at pretty thoroughly. Excuse me, I seem to have a tickle in my throat. So procedure number 2, in this case, let's see where it fits in. So we've gotten samples, that's good. Let's see if anything fits in suspected bacterial contamination for this case. Right away we can say no, because there was no fever with this case. So not suspecting bacterial contamination. So we're basically in this box here, all other unexpected signs or symptoms. The form we received, the blood component product we received, the samples we received, and we'd proceed as usual. So let's see. If a call for the pathologist triggers was received, check that the form is complete, and basically move on. So you're going to gather everything you need for your investigation, the pre-transfusion record and the samples, all the documents associated, the blood component, the samples. Start out your worksheet and assign everything there. And then go down, and in this case this was a red cell transfusion as well. So down to number 7, do your clerical check. And if your clerical checks are all identical, then as I said before, you're continuing on to do the primary examination. Number 10 is the visual inspection of that blood bag. If it all looks normal and there were no triggers for suspect bacterial contamination, we don't need to do that. then continue on to the primary exam. Okay, so back up to the top of procedure 3. So remember, we're on case 3, and her signs and symptoms were hypotension and dizziness. So if I scroll through here rather quickly, remember pretty much a primary exam is your plasma check and your DAT. A very long and convoluted way to catch every single scenario of what kind of results you might encounter, to give you direction for every different path you might take. So this is why the procedures are really long when you're really just doing a plasma check and a DAT, is to give you guidance if you find different scenarios. So let's go down here. If the plasma check DAT were positive, contact your pathologist immediately. So this might need a second phone call. If the first time you're phoning because it's a case with hypotension, and then now you're doing a plasma and check in a DAT and something else is positive, then you're going to be calling them again. And they're going to know that you are doing an investigation, so that won't be a surprise. So your questions just go this far to say, would you perform a primary exam in this case? And we're going to kind of end it there. So if something was positive, we would continue on and do the secondary exam. So that's case 3. Now I'm just going to check our chat here and see if you have any questions coming up. Hopefully it's still working. And just to finish up here is a bonus case to see if you can tell me what kind of reaction. This one is not in the assignment. This is case number 4. Just a bonus extra. What kind of reaction do you think this lovely lady is having? Now we have Wilma Flintstone. She's in ICU. She's having a redo of her aortic valve replacement, lost a lot of blood, getting a transfusion. Oh, I skipped number 1. So number 1, everything's identical, no mistakes made. That's good. Transfusion started at 7:10. Time of the reaction occurred was 13:27. But the transfusion was already done. So this is a couple hours later. Temperature, 1 degree rise, but not greater than 1 degree. Blood pressure came down. Pulse went up. And then reported here is hypoxemia. So this means a low oxygen, and hypotension with that blood pressure drop of greater than 30. And they've added in here bilateral non-cardiogenic pulmonary edema. So that's my question for you today. What kind of reaction do you think she is having? Given the time and the symptoms. And then down in the bottom of the part of the form here, she is on a ventilation assistance now. So that's the end of the case studies. Good question, just checking the chat. We actually aren't assuming anything happened in case 2 and 3. It's just asking you if you, or would you do a primary exam. We're not talking about the results of the primary exam, just if you would do one. And that's as far as we're going. Based on the questions, to answer the questions, what type of reaction occurred, you can just base that on the signs and symptoms given so far. yeah, just see if the signs and symptoms fit in with something that you have heard of in Module O. So this would be a good indication that transfusion-related acute lung injury is happening because of the pulmonary edema, the decreased oxygen, and hypotension. What would be definitely follow-up to this would be a chest x-ray. Oh, and there it is. They did do a chest x-ray. So the physician and pathologist would be having a look at that. So that wraps up this stream. And I'm just going to post something in the chat to follow up to what we're going to